She's the Senior Vice President and Chief Operations Officer at St. Mary Development Corporation. She has over 20 years of property management and social services experience. After serving as a landlord for many years, she felt called to keep people in their homes instead of just serving as a rent collector. Now, I'm a real estate broker. I have, you get passion and compassion for people. So as far as rent is concerned and home ownership is, Natalie started her career at SMDC as a service coordinator in the Biltmore Towers. What's that mean?
St. Mary Development Corporation.
Oh, okay. So they manage the Biltmore Towers also?
Just 2020. So when we first started, they asked us, like social services. Y'all remember what the Biltmore was? I'm sure you've heard of it. In 2020, we actually had the opportunity to purchase the building, and we did a roof to basement rehab on the entire thing. So we welcome anybody to, we'll give you tours.
Okay, so this is good conversation. She holds a degree from Wright State University, her OSPS from the Ohio Chemical Dependency Board, and her CHW from the Ohio Board of Nursing. She also serves on the Montgomery County Frail Elder Advisory Committee and Agency on Aging Advisory Committee, and is the King Education Chair. What's CANE?
The Labyrinth of Abuse and Neglect and Exploitation of Older. So we have worked with DX to try to prevent an ADS referral or somebody being in a situation where they need adult protective services.
Wow. So you have a lot to talk about. St. Mary Development.
I think I need to walk off that pasta anyway. Miss Veronica said there'd be food. She didn't say there'd be pasta. So I'm glad to be up here talking instead of sitting down. We did get the slides. Here you can see exactly what I've already introduced to you, but hopefully you guys have had a chance to take a look at some of these. It is a little small, so I'm going to read some of them. I'm not that person that's going to just read you the slides, but these are really important, and I think it's important for everybody to understand kind of why St. Mary's exists and why we do what we do. So every day, 10,000 people turn 65. Seniors comprise about 20% of the United States population, and Ohio has 2.8 million residents 60 or older, or 1/4 of our total population in the state. By 2034, older adults will outnumber children in the state of Ohio. I think that's really important because when you look around at a lot of social programs, a lot of initiatives, obviously we want to take care of the kids. Of course we do, because they grow up to be middle-aged folks and then older adults. And the stronger you are in childhood, the stronger you are as an older adult. But as a state, we kind of got to take a look at the fact that most of our communities are going to be comprised of older adults. So St. Mary has a belief that Ohioans are the key source of our state's strength, drawing on a lifetime of experiences, successes, difficulties, and resilience. Which kind of brings us to our mission. So what St. Mary Development is here for is we want to improve the quality of life for older adults throughout our 16-county radius. We're spanning at this point the entire state because some of the counties are a little bit closer than others. 70, 75, you can hop on and get across the state. So what started as a 16-county radius has actually trickled throughout the state of Ohio. So our quality of life depends on a lot of things: having a decent place to live, access to healthcare, adequate finances, friends and family, ability to pay for necessities you might need. These things are often referred to as social determinants of health. The thing about social determinants of health is everybody has social determinants of health, whether you're a child, whether you're middle-aged, or whether you're an older adult. It's how you access things. It's a little bit easier if you're a driver, if you're employed, if you have all of these things outlined. But if you're a senior at the end of your retirement, sometimes as time goes on, it becomes a little bit more difficulty to navigate driving. I'm having conversations with my own mother right now as we speak on whether or not night driving should be a thing that she does, just because of cataracts like me and Miss Margaret were talking about earlier. But quality of life, you want to live where you've always lived. People don't want to move across country as they age. People want to age in their homes. So St. Mary Development has two lines of business. We develop affordable housing for low-income seniors with a primary focus on seniors, but we do develop some family housing if there's a need in the area for it. And then we provide social services. These social services are in the communities in which they live. We're focusing on community health work, focusing on chronic disease prevention, access to medications, blood pressure, educations, those types of things. But we're also focused on prevention too. Prevention is one of those things. Seniors are the #1 recipient of opioids, right? Well, educating the seniors on how to lock up their medication. Hey, if your grandkids are over, here's an education on how to properly dispose of these medications. So we're proactively training our seniors so that they can make sure that some of their medications don't get in the hands of the younger folks. So it's all kind of intertwined. And service coordination. Service coordination is pretty much case management. Service coordination, the term itself is a term that HUD's given it, but it's case management all day. So it gives you a little bit of idea about the two lines of business. We'll kind of go a little bit more in detail. So from a real estate development perspective, we've developed 19 affordable apartment communities throughout Southwest Ohio, which is providing more than 1,400 high-quality affordable apartments for low-income seniors. Since our inception, we've also created 28 affordable family properties in Southwest Ohio. Most people have seen our Dayton single-family homes. There's 149 of them throughout the city of Dayton. What we found is about 60% of them are actually occupied by the seniors that we serve. And the reason why is we're in Dayton, so everybody knows somebody that's a grandparent. And it's with my 8-year-old mom with her 6-year-old daughter in the same household so that they have two incomes. So we've also, the St. Mary Connect, the other side of the house is the wraparound social service support. So we've worked with over 1,200 seniors directly just in the last year and connected them to over 10,000 one-on-one meetings and hosted 660 educations just in 2023. We kind of covered this a little bit, but this gives you a clear picture. We're Southwest Ohio, so it's covering Mercer, Auglaize, Logan, Dark, Shelby, Champaign, Miami, Clark, Montgomery, Butler, Warren, Clinton, Hamilton, and Claremont. We've got a few one-offs. We've got one in Portsmouth, Ohio. The city of Portsmouth had asked us, they had a huge need for senior housing, had asked us to develop an affordable community there. We provide social service to our 16 county there. We don't know a lot about Portsmouth and their community needs. So if we develop something outside of our 16 county radius, we partner with somebody that does. Their local community action partnership is a partner there. They're the local assistance distributor. It just makes sense. It's good for the community rather than just what would work financially for St. Mary's. We are a faith-based nonprofit that's been around for 35 years. So we reinvest any revenue we get from any development deal back into the community and the residents that they serve. So our real estate development, this is actually a picture from our VA property. Me and Miss Veronica were talking about our VA properties. So we house any senior, but we do actually have 2 properties located on the VA campus. It is veteran preference. So the way that that works is if you have a wait list, some of them are as long as 2 years. Especially with the housing crisis we're in right now. Veteran preference, the average senior is obviously eligible if there's no beds on immediately to the top. So those 2 properties have supportive service located within the buildings. We have offices there that they can come to us, but the development piece of it. So in many ways, good housing doesn't vary by age, right? Like I said before, we all want the ability to live in our housing long term, assuming that our needs don't change. We want to be close to amenities, close to family, but cost. Cost is huge right now, and you got a lot of seniors living on Social Security. Social Security went up, but it did not go up to the rate that grocery costs went up, light bills went up. If you're living in your own home, even construction costs, if you can even find anybody to do the work, it's 3 times what it was prior to COVID. So our seniors from a community level are struggling with those factors, which is how we get a lot of our people. I love that you were talking, Ms. Veronica, about real estate because it's so needed because we have a lot of seniors selling their homes to move into senior communities. I may have broke it, I'm sorry. Nope, there we go. Here's some more did you knows. The print is small, so I will give you the cliff notes. So one of the things about housing is the 3 biggest problems seniors face when it comes to housing is accessibility. Can you navigate in and out of the home that you live in? Affordability, obviously that's a huge one right now, and isolation. So some of the did you know, so I wanted to put in some fun facts because when you read them, it does a little bit in our local community these things. So more than 40% accessible. And so if you live long enough, everybody's going to need accessible housing. We also have another statistic. Households 80 and older have an average median of days of $25,000 annually, and nearly 1 in 4 seniors have an average income of $15,000 less. Our residents have an average median income about $16,000 a year. Y'all know what things cost. So independently, taxes just went up in the city. All of these things, a lot of time, is the main reason is developed through and tax. Most people think public housing, that's not the case. What we develop is different. People pay rent to live there. It's just based on income. It's make a year, then you're going to pay 30. If you make 1,500 a month, then you're going to make 30. You're going to pay. So it's structured in a conception with affordable housing. We do hear a lot. Last week, we were actually on Capitol Hill talking to the legislators about the importance of affordable housing and how many times I heard people talk about handouts, and that's simply not the case. Our seniors have worked their entire lives, but if you think when you first started your first job at $2.15 an hour, or what in over the time, your security check for 40 plus years of work is still not going to be as much as somebody that's starting their career right now at $20 an hour at McDonald's. Big difference. So the housing crisis for seniors is huge. Affordability, a little bit about affordability. One of the benefits to affordable housing, as we talked before, we're blessed in this country to have a long life expectancy. America's population of people 90 and older has almost tripled since 1980, reaching about 1.9 million people in 2010. And will continue to increase to more than 7.6 million people over the next 40 years. But having financial resources to live 20 to 30 years past retirement, the big thing is if everybody lives long enough, everybody's going to run out of money. So it is important to start thinking about some of those things ahead of time. So the last one we talked about is social isolation. More than 1/3 of adults aged 45 years of age or older report feeling lonely. And nearly 1/4 of adults 65 and older are considered to be socially isolated. So the AARP estimates that social isolation can be more detrimental to an older adult than diabetes. In fact, in some cases, the problem is very local. So in our communities, we gather a lot of information. Because we're seeing these seniors face to face multiple times, we're doing all kinds of assessments to see how we can help. Prior to COVID, 21% reported having a mental health concern. After COVID, last year's survey, so isolated or have having a mental health concern. We're talking, so at 40%, I mean, we're talking just a little under 500 people that just we serve in Montgomery County have reported feeling socially isolated. So first, we'll talk a little bit about 90%. Our units are actually 90% more accessible in the United States. We just build it that way. To be truthful, it's cheaper to build it accessible than do it afterward. So if it's going to be in this room building a home, think about that. Just go ahead and put in those lever doorknobs, put in those wide doorways, those roll-in showers, those grab bars, because you might not need it now, but you might down the road. One of the benefits of the gate when people get into construction is because let's say I moved in and I'm 65. I don't have any need. 5 years ago, some friends have to have a surgery, and I kind of need grab bars, but only on bad days. How many seniors do you know where dignity comes into play, and only for bad days, they're not going to ask their landlord to put in a grab bar. What they're going to do is improvise. We're grabbing on the sink. We're grabbing on the bathroom counter. We're probably doing something that's not exactly safe. Having it in the home helps maintain dignity. They don't have to ask. You know, there's days I wish I had grab bars after you've been working in the yard all day just to get myself in and out of the shower. Put it in there smarter. We're keeping people out of the hospital. So another thing that we do, because we know seniors like to be busy and like to do things, is we provide community space. I will say the community space has shrunk over the years because in order for you to get tax credit awards or HUD grants, it's a price. How much do each square foot cost? So unfortunately, the community spaces have shrunk over the years. We actually have our very first property, Twin Towers Place. It has the largest community room you've ever seen in a full basement. The state and federal government would never allow anything like that to be built these days, even though we know the benefit. When we were first developed, Sister Rose and Dick McBride's plan was if they couldn't make ends meet, they kept the full basement in case they needed to run bingo at a twin. It was a stream of revenue on the budget line. We were founded by two individuals that had never done this before. They just realized there was a problem. Sister Rose Wildenhouse and Dick McBride, Sister Rose recognized that when some of her sisters were at the end of their working careers, they couldn't afford anything to live. I mean, they had to room up together or try to figure out a solution, and they've dedicated their entire lives to service. So St. Mary Development was one of those things that kind of just happened. Let's see. It's going to include a picture of Sister Rose. I've already heard a couple of people in the room actually know who Sister Rose is. I wanted to show you some of the top 5 highlights and accomplishments just in 2023 around our real estate development piece. So if any of you are from Kettering, you may have seen our senior village at Kettering Town Center. We're right across from Woodman Lane's bowling alley. That whole piece that's coming up right now, that's going to be senior village at Kettering. So that's affordable housing. After I say that, most people are like, I didn't know that was affordable. That's the hope, right? Affordable housing shouldn't look any different than regular housing. It should fit into communities. There would be a little bit of less of not in my backyard if it looked and felt and acted in the same way that residential market rate housing does, which is why we do. It's why we do what we do. We also applied for and received funding for a HUD 202 project in Cedarville. Again, not in my backyard. It is an ongoing challenge getting the city of Cedarville to rally around that project. Governor DeWine recognizes the importance of it in the city of Cedarville, but it's hard. It's hard. Some of the feedback that we've heard is, well, we don't have that many seniors that are renters. Well, no, you don't. They're living in your communities. For communities, it really is, if you want to workforce housing, it's smart to develop affordable housing because you might have a senior in a 2-story house with a basement that really needs something more accessible. When that senior goes into affordable housing, their house goes up for sale, young families move in, and now you have workforce housing instead of creating new. Yeah. My solution to the workforce housing problem is to provide more senior housing so that they can sell their homes to people that will increase appreciation of the land In fact, it's there's some research that's shown when senior affordable housing goes in, the market value in the surrounding community goes up. Why? Because new homeowners buy their houses and fix them up. Not that the young people don't like those bright orange countertops and, the green shag carpet, but a lot of times they do modernize, put on new roofs and those types of things. So it actually, senior affordable housing actually increases the community's economy. We also receive some project-based vouchers. So one of the problems is this cost increase. Everybody who knows Section 8. Everybody knows that word. There's two things with Section 8. There is a personal voucher. So let's say I give you a Section 8 voucher. You can take that Section 8 voucher to any rental property that accepts it. But a project-based voucher is we work with Greater Dayton Premier Management, our local Section 8 office, and we said, here's the deal. We have our Twin Towers place, our oldest development, like I said. So it's about 35 years old. So as you can imagine, it looks like a 35-year-old property. We've rehabbed it twice, but some of the spaces need a facelift. Will you give us project-based vouchers? We don't want to raise the rent because our seniors, as I was speaking with somebody earlier, they said what they've been seeing with the vets is people have been jacking up the rents to their rentals and now they can no longer afford it. So with a project-based voucher, we can keep the residents' rent the same, raise it on the back end, local sector. Right now, we're in the process of looking at renovating their community room to have Wi-Fi because just because they're seniors doesn't mean they don't need Wi-Fi. In the past, we've had them utilize it for, we handed out Alexas. So you got to have Wi-Fi for some of those things. Just making sure that we don't have our seniors left behind in the day because after groceries, birthday gifts for grandkids, Wi-Fi with a lot of our people on a fixed income is at the very bottom of the list. So we also received some funding for 10 more 10 minutes at Flats, Dayton, some of that tornado recovery money. It'll be 10 new cottages. So one of the things that we develop, obviously we have congregate freestanding apartment community lofts and cottages that have their own private garage. We've got a huge campus off Hoover Avenue, Lions Place 1, loft and cottages. I've spoke to you about the Camp Biltmore. We did tell the Biltmore. The Biltmore was in shambles, and nobody from the previous landlord is there. I knew it wasn't good. I came from the despair those folks were living. But coming in the supportive services, we were the only people in there helping those folks. We were the only good thing about the building to be able to those folks navigate it. When the previous owner decided to sell their properties, they sold their entire affordable housing portfolio at once to Related. Related's one of the largest housing developers in the nation. They sold the entire affordable portfolio. And we were like, we're not really local. We're not really sure what this looks like. So they asked us to be owner and developer with them. We were able to completely rehab the grand ballroom that hosted Elvis Presley and JFK back in the day, completely restored. The original marble is exactly what it was. It's a beautiful thing. For me, honestly, if I were to get hit by a bus tomorrow, I could say it's the thing I'm the most proud of, is being able to see all 230 of those seniors at Biltmore finally have a home that they can be proud of. We're still to this day providing the supportive service in that building. It's a true blessing to be there. Our supportive service program, St. Mary Development, our St. Mary Connect is our supportive service sector. As I've told you, it's wraparound services, but we're doing this through one-on-one meetings, evidence-based educations, and assessments. So we know that our seniors might be lonely because we probably asked a few questions to kind of identify that. It's all voluntary. Participation is voluntary. So you can live in our building and never participate in supportive services. 92% of our seniors do, though, because we track that too. People like having it in there. I would rather come down to the service coordinator office, ask if they know who I need to call to get X, Y, and Z, than call my daughter and her ask me why I hadn't done this, or, easier than the family once had. family used to be able to have the time to kind of help navigate some of those things. But these days it is very complicated with children navigating public transportation. They may live out of state. I heard a lot of people talk about, right, Pat? So we know that sometimes you don't really live in the same place as your kids. So it's help keep seniors where they're at in their home. So a lot of people think that as you age, you live independently, maybe in your own private home, and then, you know, maybe you have a little bit of extra needs. You could move to a senior independent living community, or you could move to assisted living, and then down the road, heaven forbid, you end up in long-term care or assisted living. That's really not true. Assisted living costs about $6,000 a month. I just told you our folks are living on $16K a year. They'll never be able to afford assisted living. There's no real special exceptions for those of low income. It's really non-existent. So what happens is they live independently until some nursing home. No one wants to be it. Nobody likes being in the nursing home. Improving the quality of life to reduce the isolation. So housing quality, quality of life. I told you our mission was to improve people's quality of life. We don't just say that, we measure it. It is self-reported data. It's relevant on many things. How many hospitalizations did we prevent? So we work with the Dayton Police Department to get a local dispatch report. So if I see Mrs. Wilson on the dispatch report list, she called 911, I'm going to follow up with her and I'm going to say, hey, Mrs. Wilson, I noticed that, what happened? Oh, I fell in my bathroom. Did you need a shower chair? Let's have a shower chair to an occupational therapist. They can take a tour of her apartment. Tell her she needs to get rid of all these throw rugs, the #1 fault for seniors, and give her help with some durable medical equipment. We're just making this commitment proactively so that she doesn't end up having another fall in the bathroom. So our service coordination program, like we said, was added in 2014, the day we stepped foot in the Biltmore, and now it's offered in 13 of our senior properties in Montgomery County. This last year, we actually added a hybrid service coordination model at a 50-unit Pivotal-owned senior apartment community in Trotwood. We do provide services in Trotwood Senior Lofts. We do not own or manage that. It's a very similar situation to what the Biltmore originally was. Because if people are gonna have seniors, if they want somebody to help them out, that's kind of what we do. So it works out. We can invest in a different way. The hybrid service coordination model is a little different. We only have periodic on-sites doing educations. The rest of it's conveyed through digital signs. So utility assistance, you need to call. We've got big bold letters. So at least they're getting access to those things. We also run videos, host presentations. We've got a wellness initiative curriculum we bring to the properties, even though it's not our property, because it's the right thing to do. At this point, we have 7.5 full-time service coordinators. We only have a small focus of our staff on the family sides because families are pretty independent. We communicate a lot with them via mail. We'll send them stuff in the mail for the resources that they need, or send out a one-call phone blast about preschool enrollment, pre-K promise, summer camps, those types of things. And we're always available telephonically for crisis intervention. Let's say somebody's hospitalized and they got 1 month where they just can't come up with rent. We're going to connect them to those resources. So I wanted you to see 2023, some of the things we did because I think it is very telling and it makes a lot of sense. We've been doing this for so long. Monitoring is pretty high up there. Monitoring means we've already got their benefits in place. We already have the Medicare plan they want to choose. Until open enrollment, of course. All of it's in place. We're just checking in with them. You didn't get any letters from the job center. Do you need my help with this? What can I help you with? Those types of things, just checking in. Isolation intervention, again, that social isolation being detrimental to one's health, that's huge. We're checking in with folks all the time. And if I haven't seen Mr. Smith, he has every right not to participate in the program, but we're going to call him just to make sure that it's voluntary and it's not that he can't get out of his apartment because he's currently recovering from a foot injury or whatever it might be. We're checking in with him. And advocacy. So a lot of what we do is advocacy. Sometimes people are uncomfortable. I had a resident come to me once and she had quite a few needs. She had difficulty ambulating, difficulty bathing herself. It became a little bit more difficult. And her aide decided he wasn't going to do anything. In fact, when I showed up at her door, she was in fresh creased pants and spotless tennis shoes. He had no intent to do her laundry, take out her trash, or wash her dishes that day, but she was afraid to complain because of retaliation. She was afraid that nothing would change and he would come there and make it worse for her, which is where we come in. I just happened to be walking by when he was there. Like, oh, hey. Oh, yeah. I was just make sure it's her issues. You know, they do need that. And I was here last week. Quit. Of course he did. Because I was going to call his supervisor. Thankfully, it worked itself out, but it doesn't always. And rather than switching to a brand new company and having 2 weeks to be able to get reestablished with services, it's just easier for us to fill in that advocacy role. Another way we do advocacy, actually have a slide here, is programming. So we're bringing programs to them. We don't know all the things, but we're going to tap into those things. A great example of that is our blood pressure screenings. Work with the Cedarville nursing homes, actually at our Lions Place 2, the veteran campus properties, to do pressure screenings, illness assessments. They'll watch their blood, just working hand on hand. It's good for the residents because they don't have to walk across the parking lot to the VA for these services, and the students get real experiences. Intergenerational, it's one thing to practice on classmates, but it's another thing to practice on the population you really will be serving as a nurse. So it gives good experiences. Cold and flu vaccines, work with a lot of the building. Wright State has come to the building. End of life planning, Legal Aid of Western Ohio. We always try to make sure that we've covered all the bases and bring it to them. The advocacy piece is also huge. I did put this up here. Our 7th annual Business of Aging is Thursday, October 3rd. It is a virtual event. If you're interested, take Miss Terry's card. She'll be happy to email you some information about it. It's virtual and it is free. It's something we do to kind of raise awareness for our folks. Local community boards involvement. Also got a Hope book. Please see me after because I do have extras. We captured our resident stories. We got a grant and realized that I can tell you all day if a different thing. We actually have a lady that was a shopper. Her stories in there, which she's one of our residents. It's a beautiful thing. Understanding what they've been through helps you understand what got them there in the first place. Seeing where now isn't always fair. Some of our people have accomplished so many things. Every year, every year we have an honor flight come to our VA properties to pick up our veterans and take them to Memorial Wall. That whole building is full with Vietnam, maybe 1 or 2 lasting Korean war vets, but those folks have dedicated their lives, and to make sure that we can lift them up and show people affordable housing isn't what you think. These folks, here's their story in life. And now I'm done. Okay. I know it's at the 2-minute mark. I really appreciate you guys taking the time or allowing me to tell you the story about the work we do and the people that we serve. I really appreciate it. Thank you.
Does anyone have any questions?
I would like,
Oh, I just was gonna ask, with the VA, and the veterans, do they have to be hooked into the VA? And
No.
they don't need to be service connected
They do not.
to be eligible? I mean,
They don't. And that's what's beautiful about the properties, because almost every other veteran program, you have to be service connected. We have, I mean, I can't even tell you how many of our veterans came in non-service connected, but are now service connected because of the work that we've done. People just know. I mean, we had a gentleman who had been battling cancer on and off in various locations who got Agent Orange. Without our advocacy and helping him, I mean, it's not an easy part. Yeah, it's a variety. We even have widows that do receive their medical care at the VA they've had to wait to get there, but it's a comfortable place for them. It's something that they know.
Just when my mother was in the nursing home, my dad was a World War II vet. And so he had passed away, but they spent down their assets. She was ended up being eligible for Medicaid for long-term care,
Mhm.
but also then she was eligible for the VA from his veterans benefit to offset some of those Medicaid funding for her, the nursing home
Yeah.
stay, which then I'm sure is another process, but that helps alleviate the state's Medicaid to be able to provide more benefits for those that need it. If you get some of that cost covered that is due them through the VA.
Yes, the veterans
If that's
benefit.
what I'm trying.
And sometimes, like, let's say they want to be in an assisted living or nursing home right next to their kid, but their kids, the one next to them doesn't have any Medicaid beds. Sometimes it allows them to offset that cost. So maybe they can afford private paying a certain amount and the VA to kind of offset those costs, because that's the thing about Medicaid. They tell you where you can go for the most part, because most people just won't accept it unless you've been private pay for 2
Or
years.
they have a certain number
Yeah.
of Medicaid
And
beds.
they're always full. And they're
Oh, yeah,
always
that's-
supported.
I could make a comment to your that since I worked out there at the VA for all those years and I'm a veteran. You have to be a minimum of 70% service connected to have any type of long-term care being paid for by the VA. Anything under that, no. So the thing is, don't take that for granted. So the non-service connected veterans really are our biggest population. And there's a lot of ins and outs that with your help, they can go into, especially if they've ended up with a catastrophic illness, they can get reclassified at a level 4 level in the pecking order compared to some other things. So having worked hospice, but it is a very complicated thing, and I give you great credit for what you're doing, and it's still sorely needed. So thank you.
Thank you.
No, there is one benefit that veterans can have that they don't know about. I had a veteran I was visiting and helping him every week.
Mhm.
And all you need is 1 day of service during the war and be a veteran, and your assets under, I think, $100,000. You could own a home, you could own a car, and you could actually get up to, I think, like 1,900 or 2,000 a month. And if you have a spouse, the month is for somebody caring for you or living in assisted living. Okay?
Okay.
And a spouse can also get additional benefits if he has a spouse. And this is something that people aren't aware of. And I can send you the
No,
information.
I would love that. I would love
Does it
that.
have to be, you said wartime though?
One day, all they need in the service. You don't have to be
One
at
day.
war. 1 day during
That period?
Yeah, we have, my father was in Korea, World War II, and Vietnam. Later, mom got feeble and there was a sitting at these things. Significant meaning. You got to go to those,